Hi there, my name is Carmel Hauck. My student number is T00701793. We are going to do my canine induction today on a spay that we have. She's 6 months old. Her name is Roxy. She's healthy, happy. Her pre-anesthetic blood work had no abnormalities. Kidney and liver look great. So we have chosen HAG as her pre-meds, hydromorphone, acepromazine, and glycopyrrolate. So the hydro is our sedation and our opioid. So we'll probably see some vomiting from that, as well as a decreased breath rate. And then our acepromazine is our tranquilizer. So we will probably see some third eyelid protrusion. That one is an antiemetic, so we'll see if the hydromorphone wins or if the acepromazine wins on the vomiting. And then glycopyrrolate is our anticholinergic, so it'll have anti-SLED symptoms. We'll see him dry out, her dry out, sorry, and then probably decrease secretions as well. So we are going to go do that and pre-med her with her HAG, and then we'll come back in for induction. These are my clinic mentors, Roberta and Brenda K. Today we have Roxy. She is a 6-month-old spay that we will be going to spay today. So we're going to start with her induction. So to begin, we're going to get our tubes measured. So in our clinic, we have the red rubber ruche tubing. So I had put a little bit of air into all of their cuffs so that we can make sure they hold before we use them for surgery. I'm anticipating she's going to be a 7, so I have a 6.5 and a 7.5 as well. So we're going to start by measuring her. So I'll start with the 7. So I'm deflating all the cuffs now, and I'm just going to hover beside her. I'm not going to touch it to her, but I want to find her thoracic inlet, and I'm going to put the cranial end there. And this is going to be about a perfect fit for her. There's little to no dead space. It comes just to her incisors and just sits right outside her nose. So in our clinic, we pre-tie just because it makes the induction a bit smoother. So we put our ties on beforehand, and we just measure to where it'll fit perfect in the mouth and tie it. And then we'll pre-lubricate our tubes as well. So you just want to lubricate the entire surface, but avoid getting any lube into that Murphy eye. So that is our first tube lubricated. Now we're going to do it for the 6.5 as well. So to the thoracic inlet, we have our 6.5. Now this will be too short, so we'll have to get another 6.5 out of the drawer for her. So I will see if we've got a longer one here. So a 6.5, that one's a much better fit. So I'm lining it up again, and then measuring to the corner of her mouth here for my tie. And then I'll put some air in this one's cuff too, if we do have to use it. So we will lubricate the 6.5. And then our 7.5 might also be a bit short. Yes, that'll be too short. So we go to the cranial aspect, or the cranial thoracic inlet there. And then we're coming a bit long on that one, so we'll have to see if she needs this tube. And then we will put our tie on. And then I'm going to lubricate the 7.5. Okay, so now that we've pre-measured our tubes, we're going to start with our induction. So we are using propofol today. So I have her total dose into quarters. So we are going to go in quarter increments every 30 to 60 seconds. And then I have a saline flush syringe as well nearby. So we are going to start with our first dose of propofol. Excellent. So I'm going to turn my IV fluids on, and we are going to slowly give her her first quarter dose. And then I'm going to flush with my syringe. now we're just going to monitor to see if she is going to go to sleep. We're going to pre-oxygenate her just with a mask. So I will give that to Roberta to hold, and then I'm going to turn our oxygen to about 3 or 4 with 3. And during this time, we're monitoring for signs that she is going into the next plane of anesthesia. So we can see if she's going to give us fetal response, or she drops her head. She is panting a little bit for us here, so we'll see how that does for induction. But I believe we are about ready for our second dose here. So we'll give her her second quarter dose of propofol. So she's starting to get snoozy. We will likely give her 3 doses total before we intubate. So in another couple seconds, we'll give her her third quarter dose. And now we should be about ready to intubate. So I'm going to get my supplies over here. We're going to start with the 7mm tube. So I'm going to grab her tongue, and then I'm going to put my laryngoscope inside. So I'm visualizing her epiglottis is up, and I'm going to see if she'll let me advance past it and down into the trachea. And she did. And step 1 I know is that I visualized it going into the trachea, and there actually is a cough. So that is step 2, that I'm in the proper place. Now we're going to tie it in, and then before we put on oxygen, we're just going to give a puff of her chest, and I'm going to feel, yep, so there's air coming out of that too. So now we can put her onto oxygen, and I'm going to turn the rate down to 1 liter. And then our final confirmation, I'm going to watch her chest, and I'm going to watch the bag, and they are both moving. So that's the 5th way that I know I'm for sure in the trachea. So now I'm going to give her a breath. So I'm going to close my vein and give her a nice breath hold to 15 to 20. And there is a leak, so now we will have to put some air into it. So I'm going to put 2 mils into my syringe. Brenda's going to swab, and she's going to give me a breath hold. And then I'm going to listen as I slowly put more air in. So that's my 2 mils in. I'm going to cuff it and see if we still have a leak. So if that's the case, I believe we should be going up a tube size. So we are going to extubate her and try the 7.5. I'm going to give her a dose of propofol before we do that, just so that she's not waking up on us. Okay. So I'm going to untie her. And then Roberta's going to hold, thank you. Excellent. So I'm going to extubate her. And then we're going to grab the 7.5, open her mouth and try to do the same. So that went in a bit tighter of a fit, so hopefully this is her proper tube size. Tie her in. And then one more time, we're going to make sure that we're in, so I visualized it. We can also feel her trachea if there's two tubes there. Okay, I can again feel air coming out of that, so oxygen back on her. Excellent, and chest is moving, bag is moving. We're going to do another breath hold here, 15 to 20. And that is holding, so she needed the 7.5 after all. So we have confirmed all of our 5 things that we know are in the right place, and now we're going to turn her onto ISO. So I'm going to start her at 1.5%, and then I'm going to go put her pulse ox and Doppler on, and then I'll listen to her chest. Okay, so I'm going to do the pulse ox. We're going to put the pulse ox on her, and then I'm going to listen to her chest. So I'm going to put it onto her tongue. We may move it later, but for now we are going to keep it there. So we'll get that reading, and then Roberta's going to give me a breath hold while I listen to her chest so that I can make sure my tube placement is correct. So I have good breath sounds on that side. And I have good breath sounds on that side as well. So that's our final confirmation that we've had our tube placed correctly. So now I'm going to shave for the Doppler. So you shave with the fur, and then you can shave against the fur. And now Roberta's just giving her some eye lube while we're here. So I'm going to clean up my fur, and then I'm going to put a little dot of alcohol on there. And then our Doppler we're using today. So we just have to put a little bit of the Doppler gel onto here. And then if Roberta, you may pass me a bandage, please. I'm just going to place that on the back of the leg. Thank you so much. And then bandage it on to hold. Excellent. And then we don't have an esophageal stethoscope in our practice, so if we were to use it, we would lubricate it and then measure to the 5th rib, and then we would put it down into the esophagus alongside the endotracheal tube. So our next step is we are going to talk about why she's in the proper stage of anesthesia for surgery, which is stage 3 plane 2. So our heart rate has come down, that is anticipated, and she's taking nice even breaths. So before induction she was panting, so we can tell that she's getting into the right plane. And then we can also check our reflexes. So if I pinch her toes, her pedal reflex, there's no response. Her palpebral, no response. And then her jaw tone is nice and lax. So those are our 3 reflexes to confirm. Now we're going to go do surgery, and then we'll check back in for extubation. Okay, so we are done our spay procedure, and now Roxy is ready to be woken up. So we are going to turn her gas off, let her have oxygen for about 5 minutes and see where she's at, and then we will reassess and take away her oxygen. So ISO is off at 217, and then I'm going to just kind of prepare myself. I want to loosen up my tie so that if she were to move suddenly, I can have it off of her. And tightening it. And so with extubation, you just want to be super mindful of being gentle to that trachea. You want to avoid any sort of tracheal irritation or rupture. With dogs, we have less of a risk of laryngospasm, but it is still a risk, so you want to be very, very careful. With dogs, you are watching for swallowing, so we will see how she starts to wake up. We're just going to gently stimulate her. We're going to check if she has a blink. We're going to see if she has an ear flick, and just let her wake up. And then we still have her Doppler going so that we can hear what her heart rate is doing. She had just the tiniest palpebral response there. It's only been about a minute and a half. Take the pulse off of her. We still have her Doppler going, so you can still hear her. So it's been about 3 minutes. So we can just gently stimulate her, check her reflexes. And I'm just watching for that swallow. So I can hear the change in her heart rate. It's been about 4 minutes. So another minute, and then I'll disconnect her from her oxygen and just let her breathe through here. And her cuff was never inflated, so it is deflated, but if it were to be inflated, we would now deflate it. All right, so I'm gonna take her oxygen and turn it off and disconnect her from the oxygen. So you can hear her heart rate has increased. It's been about 7 minutes. So that was our first little tiny swallow, but that wasn't very big, so I'm gonna give her one more. All right, there we go. And we're activating in one smooth movement. And then we're just going to support her with some blow-by oxygen. And help her recover. So we'll keep her here until she's sternal or until she can hold her head up. So extubated 225. And then we're going to keep continuing to monitor her breathing, her heart rate, her mucous membrane color, CRT, all of that. And just gently stimulate her and see if she needs any reversal. We already gave her her post-op analgesia. So we'll check back in when she's a bit more sternal, and then we'll move her to her kennel. All right, so we've been sitting here for a couple of minutes with her. She is just starting to move her head and wake up. She is sitting a little bit comfortably in sternal. See, there she is. She's still pretty sleepy, but we'll keep an eye on her. So at this point, we're going to move into her recovery kennel, and then I'm going to CPR and monitor her for at least 5-10 minutes afterwards as well, and then every 15 minutes for the next couple hours. All right. Okay, so we've moved Roxy to her recovery kennel. She's a little bit hard to see because she's a black dog in a dark kennel, but this is her nose right here. So we are monitoring, I'm monitoring her respirations. I'm going to TPR her here. She was 37.4 when she woke up from surgery. We do have a heater on in the kennel to keep her warm, but we will monitor her temperature for the next little bit. So I'm going to check her CRT. Looks great. Her mucous membranes were a little bit tacky, so we just gave her a bit of a wet washout in her mouth. And then I'm going to TPR her, well, PR her. All right, so her heart rate is about 128 right now. And then her rasps are 20. So her pre-med heart rate was 140, so she's getting back to that heart rate a little bit here, but she is still pretty relaxed. She's scrunching her eyes closed. She does not want to be awake. But I will just continue to sit with her for a little bit, at least until she can hold her head up, and then we will leave her be and just check back in on her regularly. Okay, so this is Roxy now. She's moving her head on her own, but she very much just wants to be cuddled and go to bed. So she's doing very well post-op.